welcome two new guests on stage, and those are Julian Holt-Loenstad and Philippe Pollier. So please put your hands together for our following guests. Hello, hello. Please have a seat. Welcome. So nice to have you here. Philippe, you already had a very, very busy schedule today because you work for the UN. You are the Assistant Secretary General for Youth Affairs. You're the, explained simply, you're the head of the UN Youth Office. So you're not only the youngest Assistant Secretary General, but it's also a relatively new office, right? Why did the UN develop this new office?
First of all, thank you. I'm very happy.
Is the sound working? Yeah?
Kind of.
Okay.
So first of all, thank you. I'm very glad to be here for this special conversation. And answering your response, the establishment of the Youth Office within the core of the organization, it's an institutional response to try to accelerate, the emphasis we put on youth issues, and at the same time create across the whole organization better and new mechanisms to engage with young people, which I think it's the most crucial challenge for institutions globally, not only for the UN as a platform, but for any institution across the world. So I've been here 1.5 years now, and it's been a complex with a lot of uncertainties, but very challenging and hopeful route also.
Yeah, and the youth of today, of course, are the leaders of tomorrow. So you at the UN, you take care of them, so they will feel great and they will feel in good mental health. So
I think, the way I see our role and my role and the role of the office is really about creating those spaces, because we strongly believe that when young people are inside, they will make their part, I think Jean's story, testimony, her commitment not only to advocate but to take action is one of thousands, millions of examples of young people that are taking their lead, And I think that's what we're trying to do from an institutional perspective, but it's really about how we can create those spaces for young people to make the change.
Yeah, you focus on young people. Julian, you're a professor of psychology and neuroscience at Brigham Young University in the US. Could you just maybe, so you have a lot of expertise, you did a lot of research. Could you maybe tell us a little bit about the biggest challenges that we are dealing with when it comes to our mental health, that we're struggling today?
Yeah, of course, we know that there are so many challenges that exist currently. And it feels like we're not only facing a mental health crisis, but we're facing climate crisis, crises of political polarization and divisions in the world. We hear of crises around addiction and other forms. And we are also seeing what is being referred to as a loneliness crisis. And as someone whose area of expertise focuses on social connections, this is something that may be intertwined with all of these crises. And as we are more disconnected, not only does this impact our mental health directly, we know that this is predictive of development of new depression and even severity of depression. But we also know that as we are less connected, we also then have less support in order to face these crises and to get the kind of support that we need, whether that's support from friends and family, our community, and even recognizing the supports that might exist in our communities. And so while our relationships are intricately connected to mental health directly, we also see it directly influencing our ability to cope with all the crises that are concurrently happening.
Yeah, and you already mentioned a couple of them. No, you said, yeah, we have the political crisis, we have climate change. There's also digital overload, and yet on the other hand, we feel socially isolated, or a lot of people feel socially isolated. So, Felipe, do you think that young people are even more experience even more crisis?
So allow me to start, and I am a medical doctor by training, but for the last years I've been working more on policy and on the political arena. And actually my current role within the UN, it's really also a very political one, because it's really about how to make the structural changes and how we can also catalyze certain agendas that have been not on the table at the highest level for many years, And one of those, I think, is actually what we are discussing today, the mental health and the well-being of young people and adolescents, And I think when we look at the big picture about this topic, I think the first thing is that this is clearly a topic that is defining the current generation of young people, And this is a big difference with the past, For young people now, in most of countries, unfortunately, I think we still have some challenges in some countries, mental health is not anymore a taboo, It's really something we are keen and we are willing to talk much more about and to put on the table. The second, I think, and why this is a defining challenge for our generation, it's really because we are facing the highest amount of conflicts ever since the Second World War. And that definitely is having a huge impact. And Jean told us her story. And unfortunately, we have many of those young people, because young people are the most affected by any conflict, Young people, children and women are also always the most affected. But at the same time, we are facing this climate crisis, and this brings into the table eco-anxiety. We're also facing the post-pandemic challenges, and pandemic accelerated many issues in relation to depression, anxiety on young people, and we're still also facing the consequences of it. And finally, I think why this is a defining challenge for our generation, it's because we are the most hyper-connected generation ever in terms of technology, but at the same time, we are facing huge challenges of isolation, and how also this technology that could be something amazing, very positively in terms of development and impact, at the same time is having huge consequences in how our communities are organized.
Mm-hmm. Yeah, we're online very connected, but yet we feel often so lonely, and especially young people are most affected by it. So it's your expertise, right, Julian? So really getting a social connection, and you did a lot of research on that. Could you tell us a little bit about what works, and for whom can we take which measures to improve our social connection?
Yeah, first off, I just want to echo what you just said, because in addition to youth being some of the most affected by mental health, we also see that among global estimates on loneliness, it's youth that are most affected. And so these are concurrently happening at the same time. And so what my work has really focused on is all the kinds of consequences that occur around this issue. And we hear often mental health is health. And we see indeed that mental health is intricately connected to cognitive health and to physical health and even longevity. Mm-hmm. And so when we think about mental health, we need to also think of these other aspects of health. And so social health is a critical element of that. And so what we know is that we have absolutely robust evidence from multiple scientific disciplines across very robust scientific methodologies that these consequences are severe, widespread, and so the key becomes then, what can we do about it? And that's really critical, because unfortunately we're at a state where our evidence is extremely robust on the consequences, and we're lagging behind on what we can do about it. That's not to say that we don't have hope and that we don't have evidence, because we do, but we are still learning and there are still gaps in this. But there are many things that we point out, and I'll just note, I was the lead scientific editor on the US Surgeon General's advisory, and we offer many recommendations within that. And also, as I advise various organizations and governments, we recognize that the solutions need to come at multiple levels. And so it needs to come at the policy level, but it also needs to come at the institutional level, and within communities, and there is a role for each and every one of you. And so we're learning more about what specific examples can be done, but maybe if we have time, I can go into some more specifics.
One of the stakeholders you mentioned was policy level, and of course I saw you nodding, Felipe, because how, of course, the UN tries to advocate for mental health. What are the strategies you use? How do you want to improve the mental health for all these people?
No, first of all, and I couldn't agree more with Julien, but I knew it before coming to the panel, because it's just about getting into read her bio to understand how involved and how committed she is with this specific topic, you know. So in terms of some facts, you know, I think it's very important to understand that this is a global issue, you know. I come from a country very far away from Syria, you know. And before joining the UN, I used to live, I was raised, I was born, I studied, I developed my career in my home country, which is in Latin America. It's a very small country called Uruguay, you know. And it's a very peaceful country. But we have a very deepened crisis on mental health also in the country, you know. Suicide is the third cause of death among young people between 15 and 29 years old, you know. And the numbers are not improving, you know, when we see certain tendencies in some countries. But at the same time, what we see is that only 50% of countries have certain initiatives in relation to promotion and prevention, for example, of mental health on schools, you know? And I think, as Julien was saying, this is a challenge that demands us to see with broader lens than the traditional lens, you know. We cannot continue to look at the mental health and well-being issues with a typical and only medicalized approach, you know. This is a social issue. This is a community challenge, you know, and it's really about addressing it from its multiple layers, you know. The UN is currently already doing this in the ground, you know. I came a few weeks ago from Guatemala, and I got to know, for example, how the International Organization of Migration is working in terms of mental health support to migrants that are coming back from the US to the country. I was later in Guyana, and I got to know how IOM and WHO are supporting the national government in suicide prevention initiatives, you know. I think Jean and her project, supported by ILO, in terms of support to victims of the earthquake in a humanitarian and very particular context, which is very different to others, also shows what we are doing. But you know, what I'm really concerned about is that we are not discussing this at the highest level of the organization, you know. We are looking at mental health in a very specific framework. We're talking about it when we look at non-communicable diseases, and inside that umbrella, looking it on mental health diseases. But the issue is, it's broader than that, you know. And I think what we are starting to do from the UN Youth Office, and with a strict commitment also to do it in support and in collaboration with young people, it's really about creating this global network, global movement, so we can influence policy at the highest level, you know? Because that's when we recognize something, when we are able to make it visible through the data, through the evidence, that's how we are going to really change it structurally, you
So you will further invest in projects like we heard already a nice example of Jim, but I hear you say we also have to take it much on a higher level. Julian, you already mentioned that you're an advisor for the U.S. Surgeon General the advisory, and for the WHO as well. So, what would your advice be to build more resilience to be more mentally healthy?
Yeah, it's a really critical question because we need to have action. And while much of my career has been spent in the scientific realm, that science, if it stays in academia, will never have impact.
That's not enough for you. You really want to
No, we've got to change now, right? And so that's why I am so passionate about working with these organizations, particularly where there is opportunity for real change. And what we see from the evidence is that many of these outcomes are on a continuum. And so, for instance, for every increase, so I'll just give an example within the realm of social connection. With every level of increase in social connection, there's a decrease in risk. And so we see this across other outcomes as well. Why do I mention that? Because most of our efforts are on the extreme low end. Now, of course, those who are most affected clearly need our help. But if those are the only people across the whole spectrum of the population that we are targeting, we are missing a huge realm of possibilities across the population for change. And so what I suggest is that there is opportunities for societal change, population level change, that can not just affect the most extreme end, but the whole risk trajectory and that whole spectrum. And so how do we do that? In part, we can look at protective factors and how do we invest in things that will prevent, to the extent that we can, all of the factors that are controllable, right? And that also means identifying those that are most modifiable. Some things are much easier to modify than others. And so we can start investing in and targeting the kinds of things that are going to impact the biggest change. And of course that also needs to be investment across sectors of society, because we know that government and NGOs, we cannot do this alone. And so we've got to have input from all actors of society in order to help create this change.
Mm-hmm. Yeah. Maybe I still want to look. So we need all actors of society, but what can we do? Because you did also a lot of research from individual level. No?
Yeah.
Could you tell us a little bit more on that?
So I want to share with you one study that I did that we actually looked at something kind of surprising. It was very simple. We did a multi-country randomized control trial where we simply asked individuals to do small acts of kindness for their neighbors over the course of a month. It really only needed to be like once a week. And people could do literally whatever they wanted, whatever they felt comfortable with. And what was remarkable is what we found was that this led to significant reductions in loneliness, in stress, neighborhood conflict, and even indicators of mental health. Now, why do I highlight this one? The reason I do this is because it doesn't cost anything. It doesn't require trained professionals. Literally anyone can do it. And what I think is also really remarkable is that presumably the people on the receiving end benefited, but we only measured the benefits to the person providing these acts of kindness. And so what this suggests is that one of the best ways to help ourselves is to help others. And so this, I think, is a very powerful way that we can do how these small things can potentially have a ripple effect and have a bigger change more broadly. Now, do I think that this is going to be the thing that's going to solve all of this? No, of course not.
It's the one we have
but
impact
it's one way that we can start, because each little act that we do can start a chain reaction to bigger actions and bigger effects.
So after this session, you can look your neighbor deeply in the eyes and then ask him or her whether he or she needs a hug. And it's already one thing on individual level we could do. Felipe, it's Change Now. It's really an event of hope. What message do you want to give to the audience here?
Maybe before answering directly, just wanted to emphasize one point, you know. I think as Julien has been very clear, and also basing all her arguments and points with evidence, it's very clear that we need to promote mental health as a cross-cutting issue, you know, with a big emphasis of it in relation to education and how really we integrate social emotional learning in our curriculums, because that's really about building resilience and preventing, you know. And we all know that we don't need to smoke to prevent lung cancer, you know. And we know that we need to eat in certain ways to have a more healthy life in other terms, you know. But we still need much more education in relation to what is that we can do to prevent and to take care of our mental health. And also, at the same time, when we are talking about the cross-cutting and the policy, for me it's crucial that when we look at this topic, we do it with a youth-led and rights-centered approach, you know. It's not the traditional way of looking at this matter that will really change structurally the challenges we are facing. In terms of call to action, you know, I think that definitely change starts with all of us, you know. So for me, in this room and in these conferences, there's a lot of people that are change makers, you know, and they are doing a lot for everyone, you know. And I think that one concrete action is, let's also take care of ourselves, you know. Let's give us the time that we need in order to be ready to accomplish our mission, our dreams, and to help others. But this is not a selfish decision. This is really about being more impactful. So maybe that's my call to action, or what I do on my own, you know?
Yeah, take care of yourself, and then we can also take care of each other. I'm afraid that we have to wrap up this part of the session, but we won't do this without giving them a warm round of applause for Philippe Pollier and Julien